this little bit of an hour here just to present my personal experience with telehealth. And of course, I'm going to speak to the information that I know, which is really truly based on the mental health side of telehealth. And one thing I like to just preface here, a little housekeeping, is I do have my chat box open. And I do know that everybody here seems to be pretty comfortable so far anyway, as far as I can tell, as far as their use of the the chat system. And I encourage you to present your questions in the chat box. And although we are going to leave some time at the end, um, if there is something that's very pertinent to the slide that we are on, I will be more than happy to address that question in the chat box. So if you will make sure that, of course, you are on mute, and then if you can just present your questions in the chat box, we can then address them going forward. And with that being said, let me go ahead and get rolling. Um, I am a telehealth certified provider, and what that means is that through the Telehealth Training Certification Institute in, I believe it's Nevada, I have completed 40 hours of telehealth training that allows me to say that I'm certified in telehealth. And South Dakota does not have a per se telehealth certification program necessity. However, I think that to do telehealth well, um, to have an accredited program that helps you do telehealth well can be very beneficial. I'm only speaking from my experience as far as this program goes, but it was very helpful in providing me the background I needed for that. So I am a licensed practicing counselor, which is what the LPC stands for. The MH discerns the mental health piece. The NCC establishes that I'm nationally certified counselor, and the MS is that I have a Master of Science. First, we're going to talk just a little bit about what our objectives are here today. And again, I'm speaking from the platform of mental health. So the most important thing that we all want to be concerned with is, are we addressing the best interest of the client that we are serving or the patient that we are caring for? So we also want to be able to engage and satisfy them. So engaging in telehealth can be very mundane, but that can be avoided by the way that we use our body language, etc. We're going to talk about that a little bit later. We all know that telehealth, especially everything that has happened with COVID, is that telehealth can be extremely convenient. And I do see people joining us from other areas of the US, but in South Dakota particularly, we are a very rural state. And so being able to engage our clients and patients from the location of their home or from their very remote cities is incredibly valuable. And so we like that we can provide that convenience to them. We also want to just address the objective that really just want to make this statement that can be very cost effective for delivery to the convenience of somebody's home, and that helps keep the costs down in the medical world. And then it also provides them an opportunity to have specialty services that they may not otherwise be able to have. We want to really strive to reach the outcomes that we would have in a face-to-face session, but that we also can meet those objectives online with them, because we know that they are coming to us for a plethora of reasons, but we really want to get the same outcome via telehealth that we would get if they were sitting in our office. Also, we want to be able to provide them the leverage of services that they can have access to. So just a couple of definitions, and you'll notice that I've got resources posted here. As far as I know, Michaela will be more than happy to email out this slide presentation so that you have access to this information once the conclusion of this webinar. So what is telehealth? It is using electronic information, imaging, and technological communication to deliver as a professional into the person's home. This can include audio, It can include video, which we're using audio and video today, but it can also include the telephone. It can also include apparatuses that you might be able to use to help the patient and the client be able to utilize a particular form, a particular website where you can share the screen as we're doing today with them so that you can give them remote access to different types of monitoring services that you're providing. Mental health as it is pertaining to criminal justice. The one reason I decided to include this definition is the Center of Connected Health Policy, particularly to South Dakota, found it necessary to address this because we do have a lot of people in our criminal justice system who are being educated for the different needs that they have via telehealth. And that primarily has to do with, one, they may be incarcerated, or two, they may not have the means to get to the point of the class, so they have to do it from their remote city location home. And at the bottom of the screen, I've provided that connection for you to be able to go and look at that link yourself. So we're going to talk a little bit about what is legal and what is not. So when you think about telehealth, there is a lot of promotion out there right now, especially because of COVID, asking us, and I'm speaking again from the mental health aspect, to provide services across the nation. That is unethical and that is illegal. At least it's illegal for my license. If I'm not licensed in the state in which the person is sitting, I am not allowed to care for that person. If their primary residence is South Dakota and they're temporarily in Arizona for the winter and they have a residential address in South Dakota, then I can care for them. But their being in Arizona is temporary and their primary residence is in South Dakota. So it all depends on the profession in which you are in. So whatever governing body you work under is what decides if is the ethical dilemma that you could be in to be able to serve people in state or out of state. You want to make sure that you're following your licensing ethical board regulation. Okay, age of consent. In other words, is this person 18? And then of course, we'll talk a little later about how you prove the verification of the individual on the other end. But we are not allowed to do telehealth with anyone under the age of 18 without the consent of the adults in their life. Possible situations. So what if you're within a state where you license, but your client is in another state? So I just addressed that, but make sure that they are not there on a permanent basis. And what you can do is ask for proof of their residential state, being a piece of mail that's been mailed to them. Their driver's license also certifies that. But you should definitely make sure that you've got more than one certification process to protect yourself, that you are legal to see them within the state you are licensed in while they are out of state. Informed consent, we're going to talk a little bit about that. But I went ahead and included the South Dakota codified law for informed consent, mostly because I am bound by that. So just a quick question that I'd love everyone to present into the chat box if they would take just a moment and just tell me a little bit about the profession in which you might be using telehealth. Me, I'm mental health. So some of our audience, if you could give me an idea, what type of services you're providing. Okay, career counseling. Hi, Kelly. Mental health. Okay, mental health. Good, 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 good. Okay, so this is wonderful to see because then it tells me that this is very applicable. Transitional foster care. That's wonderful. Supporting coordination. So coordination of care. That's very important. So I see lots of mental health stuff coming through. That's excellent. This all pertains to each and every one of you. And welcome everyone. I'm so excited to see everyone here. I'll be happy to hear a little bit more as we go forward. If anyone has any other regulations that they want to tell me a little bit about that might support what I'm saying, or even that is contradictory, because I'd love for you to educate me as well. So I welcome those comments and questions. Thank you everyone for posting where you're coming from as far as what you're doing in your job. That's super helpful. So here's another thing that you have to look into when you are a professional operating, and everyone here that has replied is a professional, that you have to verify that your liability insurance covers you. We now know that major health insurance companies that provide, not, excuse me, not health insurance, let me say that again, professional insurance companies are now covering telehealth. Do not assume that your platform is. Please verify that. And if you work for an organization such as BMS, I saw somebody pop through that is working at BMS. I won't speak for BMS, but I'm certain that they would probably have already covered that type of situation where they know that the liability insurance is covering you. But if you are in a practice that you are operating in a private practice, such as myself, I have to make sure that my professional insurance covers me in those situations. So here's just a quick question that I'd love to see a little chat communication. Under what circumstances would your liability insurance not cover you? Just a little question to see if we can kind of get a little conversation going on in the chat room here. Anybody have any thoughts as the circumstances where liability insurance might not cover you? Perfect. Yep. Sally says, if a client was not in your state, that there again, you would want to prove that they were a South Dakota resident. Texting. Oh, and that is a great one. I would think that that is a perfectly good statement that you would want to clarify with your insurance company, and wrote texting with question marks. That would just be a great question to ask your insurance provider. Non-billable. Okay, that is non-billable for us. Okay, thank you for that reply. And it says that texting is non-billable. And I love that this is being discussed, because if any of you are familiar with, there's an organization out there right now that is trying to promote, it's called BetterHelp. And you can have a texting conversation with the people that you're providing mental health care for, but you have to be on their platform. You cannot be texting the individual from your phone to their phone. You have to be logged in on their platform to be able to do any texting back and forth. And most EHR systems that you can utilize do have a secure chat system that you can use. And for example, we use a Theranest, which has a secure HIPAA compliant chat. I won't even call it a chat. I'll call it a texting messaging board system that we are allowed to use. So does anybody have any idea why texting might not be billable and might not be permissible with your liability insurance? What are your thoughts on why that would be a problem? Okay, very good point. It is not continuous. What else? No face-to-face contact. So, and you make a valid point. How do you know that it's John on the other end of that line texting you? You have no way to verify that if he's just using his personal phone. Yeah, absolutely, Ellen. Confidentiality is completely limited here. Yeah, exactly. How do you verify that this is the person that they say they are? What about this? It can't be measurable. Okay, very good point. How do you get, yeah, so if they were texting you, how do you get that text conversation into your EHR platform? And then the other thing I'd like to add here is texts can be deleted, and then how do they have record of what they said, what you said? But if you use an EHR messaging system, that becomes part of the client's historical file. And so if you were using it on an EHR system, there would be record of that conversation. And then Michelle says, with no face-to-face contact, right? So if you're just texting, you have no way to verify that that is the person that you're talking to. So thank you all. That was really good discussion. And that is exactly what we're looking for here. We want to have this enriched experience where we're all contributing to this webinar today. Best interest of the client. Okay, let's talk about autonomy. And when I talk about autonomy, I'm talking about, are they alone in the room so that you know that there is privacy on their end of the line? So we're going to talk a little bit more about protocol as far as autonomy and privacy for them on their end. And for you on your end as a provider, I think it goes without saying is that you're in a private space. Your door is shut just as if it was a face-to-face session. You cannot be interrupted during your telehealth session with the person. Anyone else have any thoughts, concerns, questions they'd like to comment about autonomy for the client's privacy? Sometimes I've had young ones where they're sitting out in the living room and I'll say, oh, let's find a more private space. And mom will come on and say, well, I really don't have a computer anywhere else in the house. And I'll say, okay, well, to secure your young adult's privacy, could we ask everyone else to leave the room? I try to do that right at the beginning of the session. And then sometimes somebody will just, in the background, you'll see somebody flash by and I stop the session and say, so John, I can tell you're not alone. Let's see if we can fix that. Let's see if we can get you some privacy. Does anybody else have any concerns, conundrums that they've run into in the last several months as far as helping the client to maintain their autonomy in a private space? Go ahead and throw it up in the chat if you have any comments. Right, virtual learning. Clients with young children are doing virtual learning. Right, so they're very used to this environment now. However, what complicates that is when you are in a mental health session, now you need to help secure the privacy versus online learning, and you can have your teacher on one end, but then you can have your family kind of roaming around on the other. So it's a little bit different setting that you have to help people navigate. I have someone that lives in room and board. So Michelle, with someone that lives in room and board, would you mind sharing a little bit about how you might be helping that person to maintain their privacy? And then while she answers that question, Kelly Smith-Keller mentions distractions with young children. Oh yeah, doing telehealth for children from ages 5 to about 11 was extremely challenging during the most difficult time of COVID. I know we're still in COVID, but we are doing some face-to-face stuff now with our children. But yeah, distractibility is incredibly hard. Michelle, if you have any further thoughts on that, just please go ahead and note them in here. Okay. She says, I have some that live in room and board, help them to find a place in the home where there is privacy. Yes, so just do your best. And you can even say, you know what? What about the bathroom? You know, maybe the bathroom's a private space. Maybe they have the ability to take the laptop with them and go into an office or a space that they can shut a door. So yes, just helping them brainstorm where they could go that they might not normally go to just give themselves some privacy. Maybe it's outside in the backyard and everybody else is inside for lunch, something like that. Of course, not right now, this time of the year. But we have included here some governing agencies, such as ACA, AAMFT, ANA, and I didn't know if we had any nurses on board, so I included the ANA. So I just want to stipulate this comment. Ethical codes do not change whether you are practicing in person or via telehealth. So ethical codes do not change. Make sure that you remember that, and that following your ethical guidelines per your licensure. Aware of an emergency technology. So we've just pulled this item in from the Association of Social Work, and that social workers shall use technology to inform and mobilize communities about policies that will benefit individuals and groups, to seek, provide tools, opportunities, and information. In other words, what that is saying is that we are ethically obligated to stay on top of what best serves our clients well, and be familiar with the platforms in which we can deliver mental health or care coordination or forensics psychology, the ways that we can best get the information to the client. And so it is our duty and obligation to be aware of how we can present this to our people. So I think everyone's coming on board with telehealth. I haven't met any mental health provider who is not, but it is our duty and obligation that we stay on top of that. Of course, we want to make sure that we're competent and that we know what we're doing, that we are well aware of. Excuse me, let me go back here. Whoops. Okay, sorry about that. That we are well aware of and that we're competent in what we're doing here. I added a note here. Just because you're using a cell phone as part of your daily living and you use it all the time, it does not mean that you are competent using a smartphone for health care privileges. I think that goes without saying. And we also know, we've had this experience where someone will be on the cell phone on their end and they want to do telehealth, and there's all these distractions going on. And so we have to be willing to hold that boundary that, you know what, I still need you to be in a private space. You can't be at the mall. You can't be with your kids rolling around in the back seat of your car. For one, it's unsafe. And for two, it's really not giving you any privacy to really address the issues in which you came to therapy in the first place. So what are the risks and benefits of utilizing telehealth? So the convenience is amazing. It helps to overcome barriers for distances, disabilities, physical challenges of people getting to the location where you are able to do face-to-face. But what are the risks? So if you're on the phone with them, you have no visual cues, you cannot read the body language, you have no ability to read the tone and the affect. And then, of course, if you're working in a medical facility, there's no way to do any type of physical exams, of course. So it can be limiting in the nursing and doctoral field here with any physical exams. But for mental health, as long as you're able to get them on screen, you have got some huge benefits here that you can use. But you know, there's still that limitation of that face-to-face engagement that we don't get to have. But I think that most of us have navigated our way through that. I will say that we have made every effort to have our first session be face-to-face so that we can, for one, and we'll talk more about this, but verify who they are. Second of all, we try to establish at least that ground level rapport by having that first session face-to-face. I would like to ask you all, before I move on to an example of my informed consent for telehealth, is anyone else trying to do that first session face-to-face, or are you strictly using telehealth even with your intake process? Just curious what everyone else is doing. Okay. We have a little bit of mix here. We have some that are choosing some face-to-face. Yep. So kind of what I thought, there's a very mix here. Some are doing strictly telehealth. Okay. but some are getting that face-to-face time. So what we're doing here at our office is bringing them in for that first face-to-face, using masks and using that 6 foot of space between themselves and us. And we do temperature check. They've signed a disclosure about if you suspect that you've been, and I didn't include that today, and I apologize. If anybody wants that, that COVID-19 consent form, I'd be happy to share it. I know that most of you within the agencies that you've noted probably already have that in place. Yes, I love what Sarah said. Give them the option of face-to-face versus telehealth. And when I do that, thank you, Sarah, that's a great comment. I do say to build rapport, I'd love to see you face-to-face, but if you're not comfortable with that, we can certainly do so via telehealth, and we will get back together face-to-face as soon as we can. Okay, so Michaela, if you could make note of the individuals that are requesting consent paperwork so that I can email those out or provide them to you, Michaela, and then you can forward that information to them.
Sounds good, I will.
Thank you, I appreciate that. Okay, here is just a copy of our consent form, and it explains to them the provisions that allow us to do so. It talks about the conveniences. It lists me as the provider. It talks about HIPAA, and I've included, I use Theranos, and we're going to talk a little bit more about compliancy platforms, but how I am protecting them by using an online platform that is HIPAA compliant. We talk about risk and benefits. And this is a form too that any of you are welcome to utilize. I actually got it when I went through the training process I went through. So this is not my form per se, that this is available to anyone. So I'd be happy to share that if anyone is interested. It even talks further about, with the informed consent, it talks about our duties to report are included in there. All right. I'm not going to spend a whole lot of time on the screen because you may or may not be able to read the details of this on your end, but I appreciate everyone who noted that they wanted a copy, and we'll see to it that you get a copy. Okay, confidentiality is paramount. And remember too, that the clients are choosing you because they trust you, and they also trust that you will uphold their confidentiality. So just as if they were with you face to face, you are going to uphold that confidentiality at every juncture. Now we're going to talk about the HIPAA compliant platforms. I'm just going to go over the list of those, and these are in order. Doxy.me, TheraLink, TheraNest, Simple Practice, Zoom, only if it's a private account that has a password protected, VC, so that's capital V, capital S, lowercase EE, GoToMeeting, MediC, which is MEDICE or ICI, Mend, Chiron Health, VT Connect, and Mega Meeting. These were published as the top 12 HIPAA compliant video conferencing services. So I know that most of you had stipulated the agencies you were in, and so it is their duty and obligation that the EHR that they have chosen is HIPAA compliant. But if any of you in private practice, please look into that. Don't, I just say ignorance is not acceptable. We can get a HIPAA violation, and if we say, well, I didn't know, we will still be fined and put in on probation for a HIPAA violation. And if any of you have done any recent training with HIPAA violation, you don't want to be put on their probationary list, because that goes out as a statewide exposure that you've had a HIPAA non-compliancy. So make sure that the platform you are using is a HIPAA compliant platform. So how do we verify that the person that we are sitting there talking to is the person that they are? So our platform particularly has a sign-in requirement. This is why we choose to use our Theranos EHR, because we will open the session because it is tied to the person's account. So Jane Doe has a Theranos session set. The only one that can sign in is Jane Doe. We also have, she has signed all the consent forms ahead of time. And even when I went through my training, and I think this is super helpful, the first time you meet with them, if you were to have them hold up a driver's license or some kind of identification, getting close to the screen, and then you can verify that the person that you are meeting, because this might be the very first time you've seen them, that they are who they say they are. Your forms now support it, your EHR now supports it, and now the identification card supports it. So you've done 3 measures to identify that it's the person that they say that they are. And if you've already met them in person, that goes without saying that once you see them then in telehealth, that it is the person that they say that they are. Backup plans. This is really important because people lose connection. Child unplugs the cord from the computer out of the wall. I had that happen. I lose connection because of some kind of interruption on our internet. Let's see what else. Poor connection because they were on Wi-Fi and all of a sudden they're not. Any other types of situations that anyone has experienced to where you had a disconnect and had to implement a backup plan? Yeah, power goes out. That's a great one. That happened to me actually during COVID. I lost power one day and I don't even remember what was going on, but I lost power. Weather. Yeah, Kelly, great point. Internet cut off. Yep, that happened actually once when Vast was one of my colleagues, but Vast had accidentally cut their line and away the internet goes. So all these reasons are reasons that we set that that backup plan with them ahead of time. So some of the things that you want to ask for in the backup plan is, what is a phone number that I can reach you at should we lose connection? What is a secondary phone number I could reach you at should we lose connection? How you're going to sign back in once you lose connection. Because for instance, we have an EHR system that once you open a session, that session stays live. You don't want to close that session because if you close that session, now your client can't get back in. So you want to explain to them that their first line of defense is to try to refresh it, and that usually works. But if for any reason it doesn't work, that you are going to set up a secondary session and provide them a link via their secure EHR system. So risk analysis. Now, here's the part where you want to make sure that you have a plan in place if your person is suicidal. I would love to hear from everyone before I even discuss my protocol. But if anyone has some thoughts about how they're doing their risk analysis with any suicidality, high-risk patients, major concerns about safety, I would love to hear from all of you. But I will start with this. We ask for a phone number of someone who is considered to be their confidant, their healthy person that they confide in. And then I actually will ask their blessing to call them and verify that they are the backup person that I can call should I lose connection, should there be a safety concern. Do you guys have any other thoughts on that? Because I think this piece is very important. Yep, set up a safety plan on the very first session. Right, as you should with any situation, whether it's in person or telehealth. The safety plan is always put in place. Call to mobile crisis. Okay, that's great. Mobile crisis team. You have a mobile crisis team. Oh, that's wonderful. That's awesome. Okay. Have a plan together. Yes, and talk about it. Very openly talk about it. Making sure that we always have another point of connection. How about this? We have to make sure that we have their address, right? So if we lose connection and we are concerned that there's a safety issue, what is the physical address that they are currently located at? And if for any reason you notice or they discuss that they've moved locations, now you have to get the address of the new location. Thank you everyone for sharing that. I really appreciate that. That is so helpful. Let's go back a minute. Not everyone is a good fit for telehealth. And so if in doing your risk analysis, you determine that the best interest of the client is to continue because that is all they've got an option for, then that's how you continue. But if they continue to be an improper fit for telehealth, what's your next plan? Do you have a plan for that if you find that they are not a good fit for telehealth? How are you going to support them? How are you going to refer them? What can you do for them at the best interest of their concerns? Does anyone have any thoughts? When you discover someone is not a good fit for telehealth, what are you going to do with it? Okay, great point, Sal. And I agree with Sally. You return and then I don't want to mess up this last name, but it's Mortarella. I'm not sure what the first name is there, but yes, return to face to face. Yes, if face to face is an option. And what if it's not? What if face to face is not an option? What do we do? What do we do? Okay. Okay, right. She's making a good point. We can't even do face to face right now unless it's a crisis. Okay. Right. Can go out of home if needed. Okay, what about finding out if there's anyone in their area who could come to their home and they've established rapport with you, but maybe it's time to look at other resources for them that would work. And I don't know, this is just something we have to really brainstorm. Can go out of the home if needed. Okay, right. So some of you might be able to go to the homes and have those sessions, call on the phone, look out a window. Okay, those are great ideas. Thank you, everyone. I appreciate that. I think this is just one of those areas that we all have to be willing to brainstorm and figure out how we think out of the box. I love what Ellen said. Thank you, Ellen. That's awesome. Ellen says, get a consent to have another person present. Oh, Ellen, thank you so much. That is a great idea. And so that person, that safety person is not just on the phone, but Ellen is saying, why don't we see if that person could be present for these sessions? I like that. That is so helpful. Thank you. Ease of use. So when you choose a platform and you decide if this person is a good fit, if sometimes people of the older generation, it's a great fit for them and sometimes it's not. I had an 80-year-old gentleman who did fabulously with it. And then I had another 80-year-old individual who didn't do well with it at all. Or I have, a 16-year-old who just seems to struggle with technology and doesn't do well with it. So you have to look at the ease of use of the platform you're choosing, efficiency. Like if you are on a platform that is really inefficient, you have to consider that in your choice, because if their system gets bogged down, you're going to have a slow connectivity and that becomes very problematic. Okay, and then we of course have to be confident in our ability to put forth the effort to do telehealth. Make sure you know what you're doing with the technology you're using before you choose to use it, whether it be the computer, whether it be the EHR system, whether it be your external sound bar, whatever. Make sure that you are comfortable using the equipment you're using before you do it. Oh, yes. Oh, Kelly. Kelly has brought up a great webinar idea for later in, down the road, that we could talk about different theoretical orientations that would be really good fit for telehealth. And yes, I'm going to agree here that right now I use CBT for most telehealth, but I've also used DBT in telehealth. So that might be something that we can talk about down the road. So thank you for that idea, Kelly. Yes, and solution focus is very good too. So let's talk about cell phone versus personal computer. It is not wrong to use, for them to use their cell phone, but that we want to confer that they are hooked up to Wi-Fi, because otherwise you're going to get glitches, you're going to get freezes, you're going to get interruption of services. And so I tell people, if your cell phone is your only computer, I at least need you to be at home or at a private place that has Wi-Fi. Because if they are not and they're using their cellular data, almost guaranteed we're going to lose connection. And it almost happens every single time. So be prepared for presenting that to them. Safety first, we talked a lot about that, always having a plan in place. And then emergency plan in place for psychological health, emergency of the client's location. I apologize, I feel like I got this out of order. So I've already spoke about this slide. I apologize, this is probably not the place for this slide here. Let's talk about audio and visual equipment. So I'm just going to show you here. I have a little external microphone that I use. It's called the Blue Snowball. And this is something I bought when I was doing recordings for child custody evaluations, but I use it all the time now. It's just to have an external additional microphone so people can hear me clearly. I'm not promoting this brand in any way, shape, or form. This is just the brand I have. Then I'm going to show you here the apparatus I use for additional lighting. Here again, I'm not promoting this type of device. However, it is very beneficial to have an additional light on your face so they can see you. And however they're doing it on their end is not the concern, but we as professionals have an obligation to present professionally. And I think that it is important that we have the proper equipment to do telehealth. And so those are the two pieces of equipment I have chosen to add so that I can do telehealth effectively. If anyone has any other suggestions for additional lighting, oh, I just thought of one that I didn't put on here. As you can see, this is my backdrop. However, during COVID, they were promoting a lot of green screens. And I think that those are wonderful, where you don't have any background distractions. It's just a green screen. And so on their end, you know, they see whatever image you've put up behind you on the green screen. If anyone has any other ideas about what they would use to enhance the telehealth experience, I would love to hear it. Okay. If anybody has a thought on that, just go ahead and throw it up on the chat if you find something to be very helpful. So right here, I've just added some resources. Great Plains Telehealth of South Dakota has provided some very helpful information. Here again, once you get a copy of these slides, these are just resources that I found to be really helpful in doing this presentation of telehealth well. I'm not saying this presentation, but telehealth presentation to the people in which we serve. I have copied the South Dakota regulations on telehealth policy, the digital health reimbursement, so making sure that you're in all the guidelines for billing for reimbursement. And then it's kind of funny, it talks about etiquette, so website manner. So I thought that was a great little a little catchy title. However, it's very legitimate stuff. And so for instance, like I have glasses, and sometimes you'll notice that you'll get a reflection off of there. So just be mindful of those things. Or what are you wearing when you go into session? It should be the same attire that you're wearing when a person is face to face. There was a lot of joke, you know, during the most intense time of COVID, which I kind of feel we're still in, but that people would be dressed differently from the hip up versus from the hip down. But remember too that you are a professional, always dress professional, look professional, speak professional, sound professional, all that great stuff. Privacy, here again, these links are just to help you, assist you to do your job very well. And I encourage, if anyone else has any types of resources that they have found to be super helpful in setting up their telehealth resources, please share those here. I look forward to seeing what everyone else has. And with just a few minutes to spare, we are going to leave the last few minutes here to questions, comments, concerns. And so I'm going to, Michaela, if you want to jump in, or if you just want to wait and see what comes through on chat, feel free. This would also be a great time if anyone wants to open their mic and unmute themselves, and rather than typing, just wants to share some information. I'd love to hear that. So I'm just going to sit for a few minutes to see if anyone presents any questions, concerns that they have for the presentation that we're doing today.
Okay, so it looks like we actually have a couple of comments in the chat box that they feel like it's hard for people because they can't use video platforms or just don't know how to use it.
Mm-hmm.
Which, yeah.
So how are you ladies helping them to problem solve that scenario?
Now, I know for me, I'll try to find like a family member that can help them, because I do have like a couple cases like that. And so the family member of one will let them, use their cell phone for Zoom, so that I can see them. Also, I do work with individuals who are where I need interpreters. So, and oftentimes people, who can't speak English, I have an interpreter to help to get them set up so that I can see them. And then I have another case who has a staff who, I have to monitor services. So that staff helps the person as well. So I just kind of help them to reach out for other supports to get that help.
Thank you. That is so wonderful, because you're thinking outside the box. Who can they bring in to help them learn how to use the system, how to get the session, and how that for them to get the best out of the session that they can. So thank you so much for that. And then, yes, and if they cannot manage the video, it is completely okay to talk to them on the phone. A telephone call is still considered telehealth. So if the video thing just continues to be problematic, don't hesitate to have a phone call with them. Yes, Brianna, we were doing that too when we first started COVID. We were actually sending out the EHR system I use actually put together a video that we could send to clients so that they would be able to do a walkthrough. This is how you do it step by step, and that proved to be really helpful. And those of you who are technologically savvy, what would be wrong with doing your own little YouTube video that you could just send to them that explains to them how to do step A, how to do B, C, and so on, so that they can get connected well before their session. Okay, and there's a comment. We do have it clearly document why we cannot do video with them. Could you explain that a little bit more? Are you talking about?
Yes, if the person, some of our people have government Obama phones, we call them, that do not have that capability of doing that.
Sure.
We have to document in the note why we are not able to video chat with them, because it is moving towards that direction 8 months out.
Yes.
And our concern is we're going to lose a lot of our folks, because if they do not have the ability to do that and do not have the means or the money to get the ability to do that, we're good, they're going to fall through the cracks.
Right, very important.
Yeah, it's a huge concern
Mhm.
for a few of us that are on this webinar today because of dealing with Medicaid and
Mhm.
Medicare and
Mhm.
where this virus is going. I mean, we have a lot of worries even beyond that, whether our jobs are going to continue,
Mhm.
of how long this is going to continue, because we don't do therapy per se. That's not our role. Our role is more social work and connecting and linking people. Mine is supporting people at medical appointments, things like that. And we haven't been able to do that for all this time. So, and my department of navigators is very small. There's only 6 of us.
Mm.
And it'd be very cost effective
Right.
on their part. So it's a concern. It's a big concern, because our people, I've dealt with, dealing people's entire medical care for years,
Mhm.
from soup to nuts, from A to Z, and not being able to do that and having to be very creative and thinking outside the box,
Mhm.
of keeping people connected to us when we're
Mhm.
not able to do our traditional role.
Mhm.
And when our traditional role of what we do is so different than this, because we're community based. We're out in the community with people.
Right. So do you find it to be, you said documentation, yes. And then I apologize, I can't say where this is at in my slide presentation, but there is documentation that no one can be denied services because of their inability to use, in other words, telehealth cannot be denied. Are you running into that with
Yep.
them being able to have services? Because there is,
Absolutely. There's some doctors who are Medicare doctors that will not have any type of appointment unless they can video chat. And my one person in particular is not able to do that. In
and you
fact,
know what, as far as what I read, and if anyone else has a comment on this, as far as I've read, is that as a medical provider who is contracted with the service in which they are coming from, in other words, if you're contracted with Blue Cross or Medicaid, that it is a law that they cannot be denied services based on the fact that it's a telehealth presentation. That
yeah, I
they
just don't know
cannot
if I want to
deny
go to
them.
bat with some of these doctors that I've had relationships with for all these years and connecting people to, and then fighting with them over something that's a personal decision on their part, which isn't legal.
No, it's not.
I don't know. It's kind of a slippery slope.
Mhm. Well, and I guess that would be a personal preference if you decide to report them to the board or not. But my concern would be the state of our national affairs and the status of this situation and pandemic. I guess I wouldn't hesitate to report that, because as far as what I found, they're not allowed to do that. So, but hopefully you can find those ways out to think outside that box as you're
Yes.
doing, to provide them the best care that you can.
Yes. Thank you.
Yeah.
Yeah, we're used to the barriers, so we just try to jump around them.
Yeah, exactly. And I think that we all, whatever our role is, we all as professionals have to learn how to work through these roadblocks, these conundrums, these challenges that we face to do the best, always keeping in mind what is the best interest of the client. Well, the
Mhm.
best interest of the client, it's certainly better to at least talk to them on the phone than to have no connection at all. So always
Absolutely.
asserting what is their best interest.
Absolutely.
Mhm. Before we wrap this up, we do have a few minutes if anybody has any comments they want to post in the chat or to unmute and make comments. We do have just a few minutes here before we close this up. One thing I would like to mention while we're waiting for chat interaction is that every one of my progress notes at the very top, even though my CPT coding says telehealth, I always document that in my narration, that it was a telehealth session via EHR video platform, or session was via telephone, or session was started out as a telehealth video session, but had to conclude as a telephone session due to connectivity. I always put that in my narration of my progress note. Yes, thank you, Michelle. She agrees that she makes sure and puts that in her notes. Very important, because our notes should always say, who, what, when, where, why. And so there you go. That's the where and that's the how. Michaela, do you have any housekeeping that we need to address before we sign off here today?
Nope, but if you are not registered if you did not register through our website, if you just want to email me, or not email me, sorry, chat me privately your email address, and I can send out your certificate of completion for those who are completed. As well as, we also have a session going on tomorrow at the same time. If you would like to register or get more information about that, it will be on our website as well too. So thank you, Stacy, very much for your time and presenting to such a good.
Thank you for having me. It was such a pleasure to see. I did see some names on there that I hadn't spoke to in a long time, so it was really great to see that. And I just want to close with this, is that Michaela will be sending out a list of emails to me for those who wanted the additional paperwork that we talked about earlier in the presentation. And I hope that Michaela will consider having a webinar in the future about the appropriate modalities for telehealth, because I think that there are some that are very fitting. So thank you all. Have a glorious, beautiful day in South Dakota here. It's just gorgeous in Rapid City today. Thank you all.
And I will stay on just for a couple minutes just so we can get those I can make sure everyone has it, but thank you, and you guys are good to go.